The American Rescue Plan Act (ARPA), signed into law by President Joe Biden in March 2021, was designed as a sweeping response to the economic and public health challenges brought about by the COVID-19 pandemic. Among its many provisions, ARPA made significant changes to healthcare policy, including measures aimed at reducing costs for average households. These changes targeted one of the most pressing concerns in the U.S., the affordability of health insurance and medical care. Before ARPA, millions of Americans struggled to afford adequate health coverage. With high premiums and out-of-pocket expenses, discouraging many from enrolling in health insurance plans. The legislation tackled this issue by temporarily expanding premium subsidies under the Affordable Care Act (ACA). These enhanced subsidies aim to lower monthly premiums for millions of individuals and families, making healthcare more accessible to those previously priced out of the system. For the first time, individuals earning more than 400% of the federal poverty level became eligible for subsidies, and those with lower incomes saw their premiums significantly reduced, sometimes to zero. The ARPA reforms also addressed a critical need during the pandemic, supporting the uninsured and unemployed by broadening Medicaid eligibility in participating states, and offering generous COBRA subsidies to cover healthcare costs for laid-off workers. The plan sought to ensure that even during economic hardship, access to healthcare would not be compromised. The question remains: did these measures lead to tangible results for average households? Early evidence suggests that ARPA has indeed been effective in easing healthcare costs for many. A record number of Americans enrolled in health insurance through the ACA marketplaces in 2021 and 2022. And reports indicate that households saved thousands of dollars annually, thanks to the expanded subsidies. As we delve into the specifics, this paper will explore the extent to which ARPA's provisions on premium subsidies, insurance enrollment, and unemployment assistance contributed to reducing healthcare costs and alleviating financial strain for families across the nation. One key reason for this conclusion is ARPA's expansion of premium subsidies and the introduction of zero-premium marketplace plans, which reduced healthcare costs for average households. The Affordable Care Act (ACA) established a framework for subsidized health insurance coverage, primarily benefiting individuals purchasing plans through ACA marketplaces. However, the pandemic highlighted gaps in affordability, prompting ARPA to temporarily expand these subsidies. According to the study, the affordability of individual market health insurance in California, under the American Rescue Plan Act, 2021, by Fung, Price, and Wolf, 2023. ARPA increased premium subsidies for people purchasing insurance through ACA marketplaces. It also introduced zero-premium marketplace plans that covered 94% of medical costs, known as Silver 94 plans for unemployment compensation recipients. The study found that these measures significantly alleviated financial burdens for households, with 72% of enrollees reporting no difficulty paying premiums and 76% stating that out-of-pocket costs did not deter them from seeking medical care. This indicates that ARPA's provisions directly improve access to affordable healthcare. The expansion of premium subsidies under ARPA was particularly impactful for middle-income households, who often faced a coverage gap under the ACA. For individuals earning up to 400% of the federal poverty level, ARPA's enhanced subsidies reduced premiums significantly. The study by Fung et al. 2023 highlighted that many households eligible for cost-sharing reductions were enrolled in Marketplace Silver plans, which provided more comprehensive coverage at lower out-of-pocket costs. However, it also noted that some enrollees missed opportunities to maximize subsidies, suggesting the need for improved consumer education about subsidy-eligible plans. ARPA's targeted support for unemployment insurance UI recipients further exemplifies its substantial impact on healthcare costs. According to the research, automating benefits delivery, lowering health insurance costs for unemployment insurance recipients, by Lien, Lovchikova, and Feher 2024. ARPA temporarily expanded eligibility for cost-sharing reduction CSR Silver 94 plans for UI recipients enrolled in ACA marketplaces. In California, the state's ACA marketplace automatically redetermined eligibility for 79,645 UI recipients, moving them into Silver 94 plans for the latter half of 2021. This automation eliminated the need for participants to navigate complex administrative processes, ensuring that they received the enhanced benefits. The study's findings underscore the financial relief provided by ARPA's UI provision. Individuals automatically moved to CSR Silver 94. Plans experienced an average savings of $295 in premiums and $180 in out-of-pocket expenses, amounting to a total average savings of $475 over 6 months. These savings were even more pronounced for certain subgroups, such as middle-income individuals and those with chronic conditions. For instance, middle-income individuals in Silver 70 plans prior to redetermination saved an average of $968 in premiums, while those with chronic conditions saved $392 in out-of-pocket expenses. These results highlight ARPA's success in reducing healthcare costs for vulnerable populations. One of the key mechanisms through which ARPA achieved these outcomes was the automation of benefits delivery. By leveraging existing administrative records to determine eligibility and defaulting individuals into more generous coverage, ARPA minimized administrative burdens and enhanced the effectiveness of its interventions. This approach contrasts with prior efforts, which relied on informational nudges to encourage low-income households to switch to CSR plans. Studies have shown that such nudges resulted in modest take-up rates, with many eligible individuals remaining in less generous plans. In contrast, ARPA's automatic redetermination ensured that eligible individuals received the full benefits of enhanced subsidies, demonstrating the potential of automated policy interventions to improve healthcare affordability beyond premium and out-of-pocket cost reductions. ARPA's provisions had broader implications for healthcare access and equity. The expanded subsidies reduced financial barriers to care, enabling more individuals to seek timely medical attention. This was particularly important during the pandemic, when delayed or foregone care could have severe consequences for public health. Additionally, the automatic enrollment of UI recipients into Silver 94 plans helped address disparities in healthcare access, as many of these individuals were from minority or non-English speaking backgrounds. By prioritizing equity in its implementation, ARPA contributed to narrowing gaps in healthcare access among different demographic groups. The implications of ARPA's healthcare provisions extend beyond the immediate pandemic response. The findings from studies on ARPA's impact can inform future policy decisions aimed at improving healthcare affordability. For example, the success of automatic redetermination in California highlights the potential for scaling this approach to other states and programs. Policymakers could explore ways to integrate automated benefits delivery into other safety net programs, thereby reducing administrative burdens and ensuring that eligible individuals receive timely assistance. Furthermore, ARPA's focus on middle-income households underscores the importance of addressing the coverage gap that persists for this population under the ACA. While low-income individuals already benefit from substantial subsidies, middle-income households often face high premiums and out-of-pocket costs. ARPA's enhanced subsidies provided critical relief for this group, suggesting that permanent reforms to the ACA's subsidy structure could yield significant benefits. In conclusion, in this part, the American Rescue Plan Act had a substantial impact on reducing healthcare costs for average households. By expanding premium subsidies, introducing zero-premium marketplace plans, and automating benefits delivery, ARPA significantly improved healthcare affordability for millions of Americans. Empirical evidence from studies conducted in California demonstrates that these measures alleviated financial burdens, enhanced access to care, and promoted equity in healthcare. As policymakers consider future reforms, the lessons learned from ARPA's implementation can serve as a valuable guide for designing effective and equitable healthcare policies. The success of ARPA underscores the importance of targeted interventions and innovative policy mechanisms in addressing the complex challenges of healthcare affordability. The second reason supporting the conclusion that the American Rescue Plan Act, ARPA, had a substantial impact on reducing healthcare costs for average households lies in its transformative role in increasing health insurance enrollment. By expanding access to affordable healthcare coverage, ARPA directly addressed one of the most significant barriers to equitable healthcare in the United States: the high rates of uninsured individuals, particularly among low-income populations, and those in states that had not expanded Medicaid under the Affordable Care Act (ACA). Expansion of premium tax credits (PTCs). One of ARPA's most notable provisions was its enhancement of premium tax credits (PTCs), which significantly improved the affordability of health insurance for millions of Americans. Before ARPA, subsidies were only available to individuals. earning between 100% and 400% of the federal poverty level FPL, leaving many middle-income households ineligible for financial assistance. ARPA eliminated the subsidy cliff, ensuring that individuals earning more than 400% of the FPL were not forced to spend exorbitant portions of their income on premiums. Under ARPA, no household purchasing insurance through the health insurance exchange HICS would have to spend more than 8.5% of their income on premiums. This expansion was a landmark reform that drastically reduced the financial barriers to obtaining health insurance by capping premium costs and increasing subsidies for lower-income households. ARPA facilitated a broader and more equitable distribution of health insurance coverage. Projections from the Congressional Budget Office (CBO) estimated that premiums would decline by up to 100% for approximately 3.4 million low-income enrollees, while overall enrollment in health insurance plans would increase by millions. These reductions in premium costs directly translated to lower overall healthcare costs for households, as they could avoid exorbitant out-of-pocket expenses for medical services. Reduction in uninsured rates. The impact of ARPA's PTC expansion on reducing the number of uninsured individuals was profound. According to research conducted by Katsikas and Mukhopadhyay 2023, the expanded PTCs increased the likelihood of individuals obtaining health insurance coverage through HICS, particularly in Medicaid non-expansion states. Their study, which utilized data from the Household Pulse Survey (HPS), revealed that the probability of having insurance coverage increased by 0.95 percentage points among white respondents, 1.75 percentage points among black respondents, and 1.75 percentage points among Hispanic respondents in these states. This expansion of coverage not only reduced racial disparities in insurance enrollment, but also ensured that vulnerable populations gained better access to essential healthcare services. The Congressional Budget Office projected that ARPA would extend healthcare coverage to approximately 2.5 million previously uninsured individuals by 2023. The increase in health insurance enrollment was especially pronounced in states that had opted not to expand Medicaid under the ACA. For these states, ARPA's expanded PTCs offered a vital lifeline, enabling individuals and families to access affordable healthcare coverage where Medicaid was otherwise unavailable. Addressing the Medicaid coverage gap. ARPA also sought to address the Medicaid coverage gap, a persistent issue affecting millions of Americans. This gap primarily impacted non-elderly adults in states that had chosen not to expand Medicaid eligibility under the ACA. These individuals, often earning incomes below the FPL, were left without access to affordable health insurance options, as they did not qualify for Medicaid or marketplace subsidies. ARPA introduced financial incentives to encourage these holdout states to expand Medicaid. Specifically, it offered a temporary 5 percentage point increase in the Federal Medical Assistance Percentage FMAP for 2 years, covering the costs of expansion and defraying its initial financial burden. While these incentives were not universally Successful ideological opposition in certain states remained a significant barrier. They represented a critical step toward closing the Medicaid coverage gap. For the approximately 2.2 million adults caught in this gap, ARPA's provisions offered a potential pathway to accessing affordable insurance. Moreover, these efforts highlighted the broader commitment of the Biden administration to ensuring that healthcare coverage was available to all Americans, regardless of their state of residence. Enhanced affordability and access. The expansion of PTCs and the broader reforms implemented under ARPA did more than increase enrollment. They also made healthcare more affordable for individuals and families. By capping premium costs and eliminating the subsidy cliff, ARPA ensured that households across a wide income spectrum could access comprehensive health insurance without facing financial ruin. This affordability extended beyond premiums to include reduced out-of-pocket costs for medical services, further alleviating the financial burdens associated with healthcare. Additionally, ARPA's reforms played a crucial role in mitigating the economic and health impacts of the COVID-19 pandemic. The financial strain caused by the pandemic disproportionately affected low and middle-income households, many of whom were already struggling to afford health insurance. By expanding access to affordable coverage, ARPA provided a safety net for these households, enabling them to access the medical care they needed without incurring insurmountable debt. Implications for racial equity. ARPA's expansion of health insurance coverage also had significant implications for racial equity in healthcare access. Historically, racial and ethnic minorities in the United States have faced disproportionately high rates of uninsurance, largely due to systemic inequalities and economic disparities. By increasing the availability of subsidies and reducing the cost of premiums, ARPA helped to close these gaps, ensuring that more individuals from underserved communities could obtain coverage. The study by Katsikas and Mukhopadhyay highlighted the reduction in racial disparities achieved through ARPA's PTC expansion. The equal increase in coverage probabilities among Black, Hispanic, and white respondents in non-expansion states underscored the equitable impact of these reforms. By prioritizing inclusivity and affordability, ARPA demonstrated the potential for targeted policy interventions to address long-standing inequities in the healthcare system. Conclusion. In this part, the American Rescue Plan Act's expansion of premium tax credits and its efforts to close the Medicaid coverage gap represent a transformative achievement in increasing health insurance enrollment and reducing healthcare costs for average households. By enhancing affordability and accessibility, ARPA enabled millions of Americans to obtain comprehensive health insurance coverage, thereby alleviating financial burdens and improving access to essential medical care. The increase in health insurance enrollment, particularly among low-income populations and racial minorities, underscores the critical role of ARPA in addressing systemic inequities and ensuring that healthcare is a right accessible to all, not a privilege reserved for the few. The third reason supporting the argument that the American Rescue Plan Act significantly reduced healthcare costs for average households lies in its targeted support for unemployed individuals. This measure directly addressed the financial strain faced by those who lost jobs during the COVID-19 pandemic, ensuring continued access to affordable healthcare through a combination of innovative policies and automatic benefit delivery systems. Unemployed individuals and health insurance affordability. ARPA introduced groundbreaking provisions aimed at reducing healthcare costs for recipients of unemployment insurance (UI). Central to this initiative was the temporary expansion of eligibility for cost-sharing reduction CSR Silver 94 plans, which are designed to cover 94% of medical costs. From July to December 2021, UI recipients enrolled in the Affordable Care Act. ACA marketplaces became eligible for these enhanced subsidies. This policy allowed them to access healthcare coverage with significantly lower premiums and out-of-pocket expenses. A study conducted by Langu Lien, Marina Lovchikova, and Andrew Feher, published in 2024, examined the impact of these provisions using data from California's ACA marketplace. The researchers found that automatic redetermination of eligibility and enrollment applied to 79,645 UI recipients, resulted in substantial financial savings. Specifically, individuals automatically moved to CSR Silver 94 plans during the latter half of 2021 saved an average of $295 in premiums and $180 in out-of-pocket expenses, totaling $475 in savings per individual. These findings underscore the significant financial relief provided by ARPA to unemployed individuals. Efficiency of automatic benefits delivery. One of the most notable aspects of ARPA's implementation was the automation of benefits delivery. In California, the ACA marketplace utilized existing administrative records to automatically reassign eligible UI recipients to more generous CSR Silver 94 plans. This approach eliminated the need for individuals to take additional steps to access these benefits, reducing administrative burdens and ensuring timely delivery of financial relief. As the study highlights, this method not only streamlined the enrollment process, but also increased health insurance affordability for those who needed it most. This automation model proved particularly effective in addressing disparities among enrollees. For instance, individuals with lower incomes or chronic health conditions benefited disproportionately from the enhanced subsidies. The study reported that middle-income individuals previously enrolled in Silver 70 plans experienced the largest premium savings, averaging $968, while those with chronic conditions saved an average of $392 in out-of-pocket expenses. These outcomes illustrate the policy's success in targeting and alleviating the healthcare costs of vulnerable populations. Broader implications of enhanced CSR plans. The temporary expansion of CSR Silver 94 plans also had broader implications for healthcare affordability. Prior to ARPA, many eligible individuals remained in less generous plans due to a lack of awareness or administrative barriers. Previous studies had shown that informational nudges to encourage low-income households to switch to CSR plans resulted in limited uptake, with over 3/4 of the targeted group remaining in less generous plans. In contrast, ARPA's automatic enrollment mechanism ensured that all eligible individuals received the benefits without additional effort, leading to a more equitable distribution of financial relief. Moreover, ARPA's provisions addressed the healthcare needs of unemployed individuals. During a critical period, the policy's design recognized that job loss often coincides with increased healthcare needs, whether due to stress, chronic conditions, or delayed medical care. By lowering premiums and out-of-pocket costs, ARPA enabled individuals to seek necessary medical care without the financial barriers that might otherwise have deterred them. COBRA subsidies and unemployment compensation adjustments. In addition to the CSR plan expansion, ARPA introduced subsidies covering 100% of COBRA premiums for eligible individuals from April 1, 2021, through September 30, 2021. This provision allowed those who lost employer-sponsored health insurance due to job loss to maintain their coverage without incurring prohibitive costs. By alleviating the financial burden of COBRA premiums, ARPA ensured continuity of care for unemployed individuals during a period of heightened vulnerability. Furthermore, ARPA enhanced premium tax credits for individuals receiving unemployment compensation in 2021. These individuals were treated as earning no more than 133% of the federal poverty level, making them eligible for substantial subsidies that reduced their health insurance premiums and out-of-pocket expenses. This adjustment significantly expanded access to affordable health care for unemployed individuals, further demonstrating ARPA's commitment to reducing healthcare disparities. Policy implications and lessons learned. The success of ARPA's provisions for unemployed individuals offers valuable lessons for policymakers. The automation of benefits delivery, as demonstrated in California's ACA marketplace, highlights the potential for reducing administrative burdens and increasing the efficiency of safety net programs. By leveraging existing administrative records and defaulting eligible individuals into enhanced coverage, policymakers can ensure that financial relief reaches those who need it most without unnecessary delays or complications. Additionally, the targeted nature of ARPA's interventions underscores the importance of designing policies that address the specific needs of vulnerable populations. By focusing on unemployed individuals and tailoring subsidies to their unique circumstances, ARPA effectively reduced healthcare costs and improved access to care for a significant segment of the population. These insights can inform future efforts to enhance healthcare affordability and equity in the United States. Conclusion. In this part, the American Rescue Plan Act's targeted support for unemployed individuals played a pivotal role in reducing healthcare costs for average households through the expansion of CSR Silver 94 plans, subsidies for COBRA premiums, and enhanced premium tax credits. ARPA provided substantial financial relief to those affected by job loss during the COVID-19 pandemic. The automation of benefits delivery further ensured that these provisions were implemented efficiently and equitably. reaching a broad spectrum of individuals in need. By addressing the healthcare affordability challenges faced by unemployed individuals, ARPA not only mitigated the financial impact of the pandemic, but also set a precedent for future policy interventions. Its success demonstrates the value of innovative approaches to benefits delivery, and the importance of targeted support for vulnerable populations, offering a roadmap for reducing healthcare disparities and improving access to care in the years to come. The American Rescue Plan (ARP), enacted by the Biden administration, significantly reduced healthcare costs for average American households by expanding premium tax credits and enhancing subsidies. The ARP made health insurance more affordable and accessible, particularly benefiting low- and middle-income families. One of the ARP's key provisions was the expansion of premium subsidies. Previously, individuals with incomes above 400% of the federal poverty level (FPL) were ineligible for subsidies, often facing prohibitively high insurance premiums. The ARP removed this income cap, ensuring that no household purchasing insurance through the Affordable Care Act (ACA) marketplace would spend more than 8.5% of their income on premiums. This change led to substantial savings. For instance, a 45-year-old individual earning $65,000 annually experienced a premium reduction of approximately $941 per year. The expansion of subsidies under the ARP also resulted in a significant increase in health insurance enrollment. Enhanced financial assistance made coverage more attainable, leading to record high enrollment numbers in the ACA marketplaces. By 2024, over 49 million Americans had signed up for health insurance coverage through the ACA since its inception, with a peak enrollment of 20.8 million in 2024. Furthermore, the ARP provided critical support to unemployed individuals by offering full premium subsidies for COBRA coverage from April 1 to September 30, 2021. This provision ensured that those who lost their jobs during the COVID-19 pandemic could maintain their employer-sponsored health insurance without incurring additional costs, thereby preventing lapses in coverage during a vulnerable period. In summary, the American Rescue Plan substantially reduced healthcare costs for average households through expanded premium subsidies, increased health insurance enrollment, and targeted support for unemployed individuals. These measures enhanced access to affordable healthcare, alleviating financial burdens and improving health outcomes for millions of Americans.